Adenosine Adenocard mechanism of action, pharmacokinetics, and pharmacodynamics. Adenosine is an endogenous nucleoside that plays a critical role in numerous physiological functions, including blood flow regulation, heart rate control, and neurological activity. It is clinically used as an intravenous medication Adenocard to treat supraventricular tachycardia (SVT), particular. One mechanism of action. Adenosine exerts its effects on the body by activating A1 adenosine receptors in the heart and blood vessels. This leads to one mechanism of action: decreased conduction time through the sinoatrial and atrioventricular nodes. Adenosine slows down the conduction of electrical impulses through the SA and AV nodes, thus reducing heart rate. One mechanism of action: decreased peripheral resistance. Adenosine dilates blood vessels, particularly peripheral blood vessels, resulting in decreased peripheral resistance and a drop in blood pressure. Cardiac effects. Adenosine can cause adverse cardiac effects such as bradycardia, hypotension, and even cardiac arrest. 2.1 Pharmacodynamics mechanism of action. Adenosine activates A1 receptors, leading to physiological responses such as decreased heart rate, reduced peripheral resistance, and vasodilation. Interactions with other drugs. Adenosine is blocked by adenosine receptor antagonists such as caffeine and theophylline. 2.1 Pharmacodynamics. Adenosine is potentiated by nucleoside transporter inhibitors such as dipyridamole. Adenosine is not blocked by atropine. Adenosine is blocked by adenosine receptor antagonists such as caffeine and theophylline. Adenosine is potentiated by nucleoside transporter inhibitors such as dipyridamole. 2.1 Pharmacodynamics. Adenosine is not blocked by atropine. Adenosine is blocked by adenosine receptor antagonists such as caffeine and theophylline. Adenosine is potentiated by nucleoside transporter inhibitors such as dipyridamole. Adenosine is not blocked by atropine. 2.2 Hemodynamics. Dosage and effects. A 6 or 12 mg bolus intravenous injection of Adenocard. Adenosine typically does not have a systemic hemodynamic effect. Effects with large infusions. When infused in larger doses, adenosine reduces blood pressure by decreasing peripheral resistance. 2.3 Pharmacokinetics. Absorption and distribution. Intravenously administered adenosine is rapidly cleared from circulation via cellular uptake, primarily by red blood cells and vascular endothelial cells. Metabolism. Intracellular adenosine is rapidly metabolized by two pathways. 2.3 Pharmacokinetics. Phosphorylation. Adenosine kinase converts adenosine to adenosine monophosphate AMP. Deamination. Adenosine deaminase converts adenosine to inosine. Phosphorylation. Adenosine kinase converts adenosine to adenosine monophosphate AMP. Deamination. Adenosine deaminase converts adenosine to inosine. 2.3 Pharmacokinetics. Elimination. Adenosine is primarily eliminated via urine and feces. Phosphorylation. Adenosine kinase converts adenosine to adenosine monophosphate AMP. Deamination. Adenosine deaminase converts adenosine to inosine. Note: adenosine can cause serious side effects such as cardiac arrest, hypotension, and bradycardia. This medication should only be administered by trained cardiologists. Adenosine should not be used in patients with a history of acute myocardial infarction, severe congestive heart failure, or bradycardia. Note: adenosine should not be used concomitantly with beta blockers or other medications that can slow down heart rate. Conclusion: Adenosine Adenocard is an effective medication for treating supraventricular tachycardia. However, it can also cause some serious adverse effects. Therefore, the use of adenosine should be done with caution and under the guidance of a physician. Additional information: the half-life of adenosine is very short, typically less than 10 seconds. Adenosine is a highly potent drug, and its effects are typically transient. The effectiveness of adenosine in treating SVT may be reduced in patients who are chronically exposed to caffeine or theophylline. Additional information: adenosine is contraindicated in patients with asthma due to its potential to trigger bronchospasm. This additional information may be helpful to further expand upon your understanding of adenosine and its clinical use.